Good afternoon. Thank you for staying here again. Now we are opening the last session, session 8, KCA Update and Keynote on Microbiome in Kidney Cancer. It's my pleasure to introduce now Salvador Rosa, is the Chief Scientific Officer of KCA, that will present to you KCA Update. Please, Salvo.
Good afternoon, everybody. Very pleasure to be here and tell you a little bit about what I've been doing at the Kidney Cancer Association. I hope you're enjoying the meeting. It's been very vibrant so far, and thank you for all your contributions. It's been fantastic. So I hope, during the next 10 minutes, I will tell you a little bit of what we've been doing this last year, understanding some of the resources that we created, especially on our website, learn about some of the programs and data-driven programs and opportunity for collaboration, I hope. So this is just an outline. I will talk about our website refresh. It's very exciting. We have a whole new set of information that we validated with our steering committees and created a new interface, a new way of navigating this complex information for patients. Talk about a little bit about other patient programs, and then we'll dive into some of the partnership and collaboration we do for grants and conferences and other organizations, and some of the new initiatives like the Mentorship Academy and the Animal Model Workshop. Okay, so basically, this is the front page of our new website, and what we wanted to highlight here is a new way of navigating this complex information. As you see here is an example of how to treat patients with different stage of RCC. In this case, we go for radiation therapy. It's a new way of exploring this information for patients. And it's now with social media, you're used to scroll all the time. So we are creating pages that are a little bit longer until you get to the point where you click and you dive into a topic and you find exactly where you want to have more information. Like in this case on this interventional radiology talk that the patients can get to. In this other case, understanding kidney cancer, it's, again, very easy to navigate with very quick link to, for instance, population at high risk. We learned from Nizar about carriers of sickle cell trait, how these are connected with RMC, and it's easy for patients to, just jump to the section where they need to find the right information, and again, dive into the resources and, further, information that will lead them to go deep into that topic. So I hope you will explore and recommend this resource to your patients, and also trying to find things that are useful for US and Europe. So these are definitely universal content that you can use. Another very piece of information and tool that we created was the Kidney Cancer Unfiltered podcast. We are dropping season 3 and his 6 episodes, and our host is Ana Maria Scaccia, who is a cancer survivor, kidney cancer survivor, and she has the ability to really go easy on patients and tackle many different family points, but also have the ability to work with researchers and clinicians trying to tackle some of the complex discussion with research and clinical research and clinical trials and all of those topics that are helpful for patients. So highly recommend as a companion for your walks or gym training sessions and so on and so forth, but also for patients, of course, to listen to. And the other resource that I want to point you to is the community support, our Facebook private group. Of course, this is a space that is 6,000 members strong, and our community really includes patient caregivers and advocates. Is kind of mildly moderated by ambassadors of the KCA. We don't really take any strong point, but we really monitor what are the trends and what is treated and what topics are really surfacing in the community and trying to take some of those seriously. So you hear a lot of what would you do in my situation, but also a lot of misinformations and things that are permeating the internet on different communities and also permeating this community. So we keep it as a pulse of what we need to address and clarify for these patients. So highly recommended because of course it's a safe space and we always trying to have good moderation. Okay, now I shift gear and I'll tell you a little bit about our partnership. One in particular that I'm very proud of is the partnership we had with the Cancer Research Institute. Last year, we launched a co-funding opportunity in the space of immunotherapy. So many organizations fund cancer immunotherapy. The spin that we wanted to have in collaboration with them is to do something specific for kidney cancer. So in the last 5 years, CRI has funded many CLIP grants, this specific clinic and laboratory integration programs, but only 2 were funded on kidney cancer. So we said, why don't we try to have another grant? You see here some of the details. So very happy to say that we selected the first recipient of the KCA CRI, Kidney Cancer Immunotherapy Award, but one of the consequences that happened was that there were multiple applications submitted. So the level of the science was so good that basically we had another 2 winners. And the CRI, of course, funded another 2. So we have a total of 3 for a total of $900,000 that goes into kidney cancer. And we are very happy about that. So we're trying to do it again. I think the experiment works. And again, another organization, Rising Tide. Some of you may have received some grants from them. They're based in Switzerland. And we are trying to do, of course, they're like funding any type of cancer research, but our focus trying to spin this into kidney cancer. So it's going to be announced very soon. So keep your subscription to our newsletter updated if you're not there, so that you'll see the announcement in the second half of 2025 for a specific grant that is going to be on early detection of kidney cancer. On the same pattern, we're also trying to collaborate with other organizations and societies. So for instance, very proud of our collaboration with European Multidisciplinary Congress on Urological Cancer last year. Thank you to Axel Bex and Laurence Albiget for co-organizing 2 kidney cancer sessions at that meeting. We brought our signature sessions, the wood fire and the practice changing paper, to kind of give the vibe of this meeting to a different audience so that we can, of course, bring some of those into our meeting. Same story with the ASTRO, so the American Society for Radiation Oncology. In 2025, we're doing an ASTRO KCA joint session that is going to be focused on kidney cancer for radiation therapy, thanks to Chad Tang and Shankar Siva. And brings me to this meeting in particular. And last year, we decided to embark on a new piece that we thought could be helpful, an enduring piece that will kind of amplify the message that we hear at these conferences. So we basically launched the first conference proceeding publication in collaboration with Medicom. So you can scan the QR code and read both the 2024 European and 2024 North American proceeding, one in collaboration with Medicom, the other one with the Kidney Cancer Journal. And I'm very pleased to announce that we're going to have another issue. This publication will be made with MDPI this time. So all oral, abstract and oral presenters are invited to contribute to the issue. It's going to be, I think, nice enduring piece for some of the of the messages and the paper and abstract that were presented. Okay, now I'm going to tell you a little bit about the scientific initiatives and the think tank. You've probably seen in the program that we started on Thursday, not on Friday, the conference, with some internal meetings, initiatives that are, they say, by invitation only. I just want to open the invitation to all of you for next year, because these think tanks are really the opportunity to bring global experts and address clinical challenges, build consensus. So if you have any of this topic that requires this congregation in a small setting of 20, 25, 30 max, individual, then we can, or these meetings are very, very helpful. So we have a think tank at every meeting, the Thursday before the conference starts. I just want to highlight some of the outcomes that came from 2023 North America, Pavlos Msao and Stephanie Berg on post-progression therapies on overall survival. This was published last year in Neurologic Oncology. And the 23-24 European meeting, Jens Blackmore and James Jones, they brought the community together for digital pathology state across Europe, molecular diagnostic and biobanking. And last year, the same meeting, Michael Steller and Laurent Salbige also talked about, with other experts, about consensus on future pathways of adjuvant therapy for RCC, and this is under review at the Cancer Journal. And lastly, last year, also at the North America meeting, Dan Shapiro and Mary Carlo developed a very good discussion on biomarkers, methods for risk classifications, improve clinical decision-making for patients. This year, the topics were led by Jesus Garcia-Donas and Ignacio Duran on exploring AI for kidney cancer treatment, and then we had Grant Stewart and Axel Becks in defining perioperative trial in RCC and the work that has been done by the IKCSEU group. So my take for the audience is really, if you have any topic that you would like to discuss in this setting, please send me an email and we'll try to set it up for next year. Last but not least, something that's new that I strongly wanted is the first RCC animal model workshop in collaboration with UT Southwestern. It's going to happen in Dallas, September 11-13, and the scope of the meeting is to classify, characterize all RCC animal models. We'll have pathological, molecular, and therapeutic validation, and we'll also kind of make recommendation about model applications. We've seen so many therapies and modalities being developed, but it's critical, important for preclinical validation to put it in the right model and to have the right readouts. It's invite-only workshop. This is going to be very hands-on. Everybody who comes to the meeting has something to do, but there are few opportunities. So if you are actively working on developing new models, please reach out because we want to hear from you. We want to invite you if you're in the field and in this topic. It's going to be a stellar organizing committee, and the slots are filling up very quickly. So thank you very much. These are my just take-home message. I hope you learn more about tools that you can use with your patients, recommend to your patients during their journey to find reliable information and support groups, and also be aware that we are actively working with everybody. So our second name is partnership and active partnership. So we want to work with all of you and other organizations to grow the field and foster new collaborations. So thank you so much.